Well, at the HBOT News Network, we've covered a lot of the PTSD and the brain injury, and I'd like to shift gears now. Let's talk about the top two killers, okay? If you look at the CDC death rates, you'll see heart disease and cancer. And so from the standpoint of heart disease, I think it's important for us to just, let's look at some of the case studies, some of the areas that you have experience with patients that are dealing with, all the variety of conditions that are cardiovascular.
Well, I'm going to go back to the history, like you said. Hyperbarics in its current evolution has actually started with cardiac surgery. It was a way that you could actually stop the heart for longer periods of time and do valve replacement. So that was one of the roles, and that was pioneered by the guys that were in the Netherlands, okay? And that was...
Operating rooms were chambers.
They were, and a lot of the earlier implementations of hyperbarics in North America were as operating theaters. It's unfortunate because then a doctor who's been in there for a period of time has to go through decompression, so that's not what most people would like to subject themselves to because it takes time. But it is an effective tool, and used effectively, it can make the difference in a lot of cases. Cardiac surgery, one of the first patients that I treated was a necrosing cardiac surgical patient that had a necrosing sternum. The most important thing was the response of the cardiac surgeon when he asked him to roll back his shirt so he could see the wound, which prior to the start of treatment had been black, and when he rolled his shirt back, it was fuchsia. The change in the physician's face just was it was just amazing. So that was something that was interesting to see. I think a lot of the physicians that are out there today, the reason why they haven't considered hyperbarics is because they haven't been exposed to it. If they were exposed and they could see what it was capable of doing, it would make the difference. Mm-hmm. We've seen that with surgical patients in necrotizing infections. The implementation and the inclusion of hyperbarics makes a difference and minimizes the tissue loss. So,
Elena, your experience with some cardio patients, if you have some.
So I would have to say that I haven't yet gotten patients who come in specifically for heart disease. However, I've had patients who, like I said, come in for a different condition, but then report back to me that because of hyperbarics, their heart works better. Now this is measurable by something we call ejection fraction. And so I've heard that probably I could say from about 3 people who have reported improved ejection fraction from doing hyperbarics alone. Now there are stipulations as to how the percentage of ejection fraction has to be a certain number before we can put them in a hyperbaric chamber. But the ones who I'm talking about are essentially on that borderline of heart function, and so those numbers for them improve, which is a good thing. Mm-hmm. So that's that. I haven't gotten anybody who comes in specifically for something for their heart, not yet.
Well, I did speak with someone that was a patient. Him and his girlfriend were patients. They were in their late 60s, and their heart function was down in the less than 50%. Probably wouldn't have made the cut, but didn't come for that reason.
Right.
They came for health reasons.
Sure.
And then they did 28 treatments, I think, at Extivita, and then the pandemic hit, mm-hmm. and they were locked down for 7-8 months. And then they went back to their cardiac specialist doctor, right. and he remeasured it, and they were in over 70%. Mm-hmm. And he thought, well, how did that happen? Like, what did you do? And they were just thinking we didn't do anything. And then they came back to, well, we did 28 hyperbaric treatments. Right. Now historically, and hopefully, Tom, you've heard this, but I was doing some research that I can't find, but in the 90s, I want to say around 93, the American Heart Association endorsed hyperbaric oxygen for healing heart attacks and the damage due to heart attacks in 1/3 the time. And so this
Wow.
this article was published.
Wow.
And then it disappeared.
You know, there's a lot of things that come and go and that you'll hear about, and then they're retracted.
I read it, but it was an older article. I read it.
I'd have to look for that one because
I kicked myself for not printing it out, and then I went back because I had a link, and the link was broken. And just like, oh.
Yeah.
And it was published. It was a published article about them endorsing it.
Well, let me tell you, lately, we're seeing a higher incidence of things like myocarditis. Myocarditis is actually inflammation.
Around the heart. Right?
And in this case, hyperbarics could have an intimate role in bringing about improvement in the condition. Will it heal it? Who knows? Okay. Are there studies about it? Not really, but there's never been a lot of studies about hyperbarics, and the structure of the studies comes into question because when we look at the hyperbaric studies that are out there, you look and see that they're always comparing hyperbarics to slightly pressurized room air. Well, the slightly pressurized room air, and then what you'll see is that traditionally how they write it up, and it could be cerebral palsy, it could be post-traumatic stress disorder, the same write-up, just replace the words. Both groups improved from baseline. However, there was no differentiation between the groups. So then it's a negative study. Well, that was done in the Collette study with cerebral palsy. That was done with all the military articles, even though they saw improvements. So the structuring of the studies has been brought into question, and just recently there's been a PhD student out of the University of Wisconsin that has actually reached out to look at the therapeutic effects of hyperbaric air at 1.3, slightly pressurized room air. And what he's been able to do is document mobilization of stem cells. Mobilization of stem cells, 3 different types of populations of stem cells have been mobilized in his work. That brings into question, it doesn't bring into question, it actually says, hey, listen, we need to rethink all of hyperbaric studies that have been out there so that we can actually present them to the mainstream medicine and have them considered again and have them relook at this.
So let's just hypothesize something.
You can see from, you asked about the MI study that you can't find. But just by basis of how hyperbarics works, you could see why that did work, how that was very helpful for these folks who had cardiac arrest or myocardial infarctions, not cardiac arrest, myocardial infarctions. So with the reoxygenation of the heart, with the stem cell mobilization, with growth of new blood vessels, you could see how the heart does start to basically regenerate and get better and heal. So that is not such a leap of faith to say how hyperbarics can help with somebody who had a myocardial infarction, just based on the mechanisms of hyperbarics itself.
Well, is it fair to say that when the heart is damaged from a heart attack,
Yeah.
it's like a wound
Yeah.
in one of your organs, right? It's like-
In your muscle.
And so it's used for wound care. 1,500 hospitals have it, and they're using it for wound care, that non-healing wounds. Why wouldn't it benefit? And if hypoxia and the inflammation that results from that is causing damage, and you remove that, why wouldn't that be good? It makes no sense. This coming from a structural engineer. You don't need to be as expert as the two of you are to even have seen it, to understand that if I had a bad heart, I'd be in there getting hyperbaric treatments, and if I had a heart attack, I'd want to be in the chamber.
Yeah, that's a perfect place that you would want to have a chamber because you're super saturated. I just pulled up an article that says the effects of hyperbaric oxygen preconditioning and myocardial biomarkers and cardiac protection in patients with bypass. So if you precondition prior, the number one complication out of cardiac bypass surgery is post-cardiac surgical stroke. If you can actually precondition, you can avoid this. And so that brings out cost savings.
Better outcomes.
better outcomes, but it also affects where we take hyperbarics today. You know, one of the chief things, now coming from Canada, I've seen managed healthcare or universal healthcare. One of the chief things that has always been identified with how healthcare is practiced in the United States and Canada is it's for profit, okay? It's for profit, and it doesn't emphasize health and wellness. And if we look at doing that and reinstituting a payment process that actually rewarded people for managing patients and avoiding conditions, then it would be beneficial, and it would bring about significant savings in how we do healthcare in the United States and Canada.
Yeah, I think there's been some discussion about that, and how do you transition the current medical industrial complex to being incentivized to make us healthier.
Right.
Yeah, we need to do that. So.
We talk about the patient benefits and the outcomes, but you're speaking about the healthcare burden and the healthcare cost burden for the country, and it's significant. And how can we possibly decrease that by using hyperbaric oxygen therapy as one of the treatments for all these conditions that we're talking about today.